Thank you for joining us for Creative Healing for Youth in Pain's February webinar, How to Get the Best Pain from Your Child's Doctor. My name is Ashley Mateka, and I'm the Executive Director of CHYP. For those of you new to CHYP, CHYP is an online nonprofit organization that is dedicated to empowering youth living with chronic pain to heal by altering the brain's pain circuits through exposure to creative healing experiences, educational resources, and peer support. Today, we are thrilled to have Dr. Jody Thomas as our guest. Dr. Thomas is a clinical child psychologist and founder and CEO of the Meg Foundation. We are also joined by CHIP's founder and president, pediatric pain expert, Dr. Lonnie Zeltzer. Thank you, Dr. Thomas and Dr. Zeltzer, for joining us today.
Thanks, Ashley. And I just have to thank everybody who's coming. And this is your time to ask all the questions of our expert that you want to really make each visit with your child's doctor, nurse practitioner, clinician the most valuable, so you leave feeling satisfied. And I will say that Jody and I go back to the dinosaur days. Jody was a psychology intern at UCLA back when, rotated through our program and was just superb. And here we are years
Many,
later.
many years later. Yes.
Right. So I'm going to kind of start by asking Jody, the focus is how to get the most out of your visit with your child's doctor. And maybe, Jody, you want to start with what you see as the most critical piece of that visit.
Yeah, I think there's actually two main things that I talk about when we're talking about this with families, because a lot of times we were going in, this is when we're going into the big appointment we've been waiting months for, we're looking for our answers, and so really want to go in with a goal. What do we want out of this? To really think about and ask, okay, so if I'm walking away from this appointment, if I'm at here at the end, what would need to happen for me to feel good and satisfied with this? And that helps you really have, rather than I want them to figure everything out, which of course is an overall goal, but not a terribly specific one. And so some of that goal might be I want to know next steps. I want to know what the things we should be doing. I know how are we ruling out something that needs our immediate attention. I want to be able to have a path forward, and I want to be able to or communicate the large complex picture, because as you know, and likely if you're listening to this or watching this, you don't have a simple straightforward issue that you're dealing with. It's probably pretty darn complicated. And that really brings to the second point of walking in kind of prepared to tell your story. And that can be tough because a lot of times this is a long and winding tale that's had a lot of ups and downs. And so being able also to take some time, making sure that the provider is going to have access to all of your previous records is going to be great. Ideally, in a magical universe, the provider has had time to review those records. But I think the reality is they might not. And to be able to come in, and I am a big fan of creating a bullet pointed list of our major points, a great little timeline with our major bullet pointed points, because it not only very much helps that provider, but also helps you tell the story in a way that's going to be a little bit more linear and a little more succinct. Because you, as a parent, are going to be intimately aware of your child's story and all of the details. And they might be quite relevant, but they also might not fit in with the span of this appointment. And so, really being able to take some time to do sort of this bullet pointed timeline to think about what do I think are the most relevant things. That said, also putting in the things that you might not completely see as relevant. Like when we're talking about we're missing a lot of school, we're really anxious about things, we're seeing things, to really start thinking of it from a biopsychosocial perspective. And biopsychosocial perspective model, which I know is a large phrase that often when we say biopsychosocial, this is when everyone stops listening because it seems hard and complicated. But really thinking about it, knowing that no matter what the end result of a diagnosis or a treatment plan, all of them are going to look at the biology of what's going on, the psychology of what's going on, and the social aspects of what's going on. And so the fact that your kid's missing school is going to be irrelevant. The fact that they haven't been seeing their friends is relevant. The fact that they no longer want to do the sport or play the thing that they really love is relevant. So being able to put all those things within a summary is going to help you as a parent and as a child going in feeling more prepared to tell their story. And to answer that question, so why are you here today? And being able to give an answer to that.
And what about at the end of the visit, the doctor says, well, here's what I think, maybe you have EDS, not the genetic type, but your child's not dislocating, but your teen is very mobile. And so that's why there's a lot of joint pain, arm pain, leg pain. And I'm recommending physical therapy and psychotherapy. And the child thinks, I'm not crazy. Like, does he think this is psychological or maybe? How do you address that?
First of all, I think it's fantastic whenever there is the recommendation of psychotherapy, of PT, to be able to kind of call out what very likely could be the elephant in the room, very likely is the elephant in the room, which is why. Why are we recommending this? And how does this go? Right? That we're not just yes, sir, when all of these questions of, is this just dismissing? Do they really not believe me? Does this mean they really don't think it is? Do we really not? Wait, we're not going to do a scan. Why aren't we doing a scan? That we're actually being able to have a conversation about how the thought process is going. And so, or even call out some of the things as parents and being like, okay, Dr. Zeltzer, so later this evening, when my teenager tells me, when he's like, hey, so I think Dr. Zeltzer thinks I'm crazy. And so I don't want to go to therapy because I'm not crazy, that we can address that now and being like, hey, Dr. Zeltzer, can you explain why psychotherapy would be suggested for this? Why am I talking to you? Do you think they're crazy? And being able to call that out and even doing that, with a little bit of humor and spark being like, I'm guessing you don't think we're crazy, right? And being able to call out that dynamic in the moment so everyone walks away with an understanding. So you as a parent aren't left sort of trying to justify something later that you're not quite sure, or even you as a parent being like, I don't know why they're telling you. They said it was important, so I guess we should do it. But coming out being like, I want to know why each of these things, like in your example, Lonnie, saying, okay, so we think you might have some hypermobility. This might be Ehlers-Danlos syndrome, so we need to go to PT. Now, if I'm a parent who's never heard of Ehlers-Danlos syndrome, I'm like, why? My child has a disease and you want me to go see a physical therapist? What? Why is this? What do we need to do? How would we diagnose this? What would we do? Being able to come and be like, okay, can you tell me how this would help? The magic question I always think in those interactions is the how questions. How did you come to that conclusion? How do you know it's not something else? And how do you think this would help? And how quickly do you think it would help that we know this and we're on the right path? Because particularly when you're talking about things like PT and psychotherapy, this isn't we go once and we're done, right? These are setting that expectation that these are solutions that are going to take a little bit. But what are the signs that I would look for as a parent to know that we're on the right path? How do I know this is going to be helpful and useful for my kiddo? And how do I know? Because again, unlike a medication where we might know within weeks whether or not that's helpful or days, depending on the point of that medication, this is going to take a while. And being able to set those expectations and have that understanding becomes incredibly important. Like, how quickly do we see a response that would tell us that this is the right path? because it also allows, like, a lot of us as providers, this is our bread and butter. We're doing it every day, right? This is our thing. And so sometimes we have, what we call that curse of knowledge. We understand how this whole picture gets together. And sometimes that can create a deficit in the communication with patients about, oh, they don't live and breathe the biopsychosocial model of medicine every day. So maybe we need to spend some time. But for a parent going in and saying, okay, help me understand. And also, what are some good resources I can look at later that are going to help me explain this to my partner, explain this to the school, explain this to, the other friends in the group? I always think that is a great question of how would I explain this to the people in my child's world that's going to need to understand. And that also helps you go forth as a parent feeling less anxious about how we're explaining this in the world. And it's this beautiful thing with a child there as a first model of how are they going to explain this to the people in their world too.
What do you do when, or what does the parent do when the doctor looks at the parent and begins asking the parent the questions while their 15-year-old or 14-year-old child, teen, is sitting
10-year-old, yeah, but certainly
down?
older, right? I think one of the best things to do, and there's kind of two different parts of that dynamic. One is, right, like whether or not the provider is actually just initiating some of that conversation with the child. And then the second part being whether or not the child is allowing themselves to be engaged in that interaction. So let's pull those apart for a sec. So time one would be being able to, if a doctor is coming in, and particularly if they're starting out with that conversation, to you, is to be able to remind yourself as a parent to always allow the child to answer first if they're going to. And I always kind of like to be like, do you want me to take this one? Like, if you ask a child about their medication history, they're often not going to be great at knowing that, right? But acknowledging that it's not just about you taking over, but it's also about if a doctor is directly asking you a question, turn around and be like, hey, what do you think about that? Actually, so and so can let you know himself. He's clearly the expert in himself. I would love him to tell you this story. But being able to redirect that question back to the child and using your own eye contact to be able to guide that. So if you're looking at the physician's looking at you, that's where they end up. But if you're looking at your kid, it's going to get real. There's a natural instinct to go and look at where you're looking, right? And so there's first is to be able to use some of those nonverbal cues and to use your role and realize that you do have a lot of power and control in that room as a parent. So the second part with your child is to one, like, acknowledge some history in this. Because my guess is when you're in a room with these providers, this isn't your first rodeo in dealing with providers. And there's likely some previous trauma, some previous experiences of not feeling believed or being discounted that could be at play. So we just want to sort of acknowledge that, but also be able to acknowledge the fact that we want that their voice is going to be the most important voice in that room for telling their own story. And to be able to say, and I would do, that's where the prep work comes in before we're going in that room, to not be like, talk to the doctor. We don't want to create this like shaming, scolding thing within the room, because that's not going to go well. But to be able to, and we're in that car the night before, and we're talking about the appointment, and we're going over to, even when we're making that history of list, being like, hey, bud, I put together this list and this history. I would love for you to go over it. I want you to tell me if you think I'm missing anything, if you think that there are important things that I'm not putting in here, where there's the setting of that tone that they're the ones who really need to own their story. And be like, great. So when we're going, I'm here for backup, and I will fill in the holes and support you, but I really want you to be the one who's telling the doctor about your experience, because I want this to be for you. We're here to help you find a path forward and feel better, but that's only going to work if we really have you be the one who's doing that. And it creates that dynamic from the get-go, so we're not kind of in this kid being corrected at grandma's dinner table type of dynamic of scolding and shame, um, when that's undoubtedly happened to them before. We don't want them to feel like they're in trouble in math class, right? But we're establishing that point for them to feel empowered.
What do you do as a parent? Your child has headaches and you've brought him or her them to the neurologist, also has stomach aches and you brought your child to the gastroenterologist. Maybe you've also, because of arm and leg pain, brought your child to the rheumatologist, and each is giving you their own medication recommendation for their body part and their problem, maybe telling you something a little bit different that might contradict each other. How do you navigate that all? How do you put it together?
This is an excellent question. And it talks about, I think it really touches on the challenges of our very traditional Western medicine system, which loves to operate in silos. When we're talking about a very multi-systemic issue that is always a multi-systemic issue and where those run up against each other. So part of it, so the answer is a couple of different things, I think, depending on your situation. I think this is ideally the glory of a pain psychologist, um, and who's sitting there and helping you put all the pieces out on the table, essentially, and figure out how they're going to fit together. And also paint the picture for the fact that all of these pains and all these experiences do come together in some way and help you develop the story for yourself and for your child about how that works and also how that's going to influence the path forward. That how are we going to take all that information? So I think having someone, sometimes in a magical universe, that can be like a pediatrician, but I think a lot of pediatricians don't have sort of the time or experience to do that. And that's not a knock against pediatricians. This is just the complexity of the situation at hand. Sometimes that can occur, sometimes it can't. But I think ideally what we're doing is being able to, because in that there's a recognition that we need to have that story. We need to have that conceptualization of where these pieces fit together. So we can have a confidence in that path going forward, in that PT, in that medication, but we have a reason and an explanation for ourselves of each of those pieces and why.
How do you deal with, as a parent, physician? So you've gone to one, let's say, gastroenterologist for stomach problems for your child, and you feel like the child's pain is still a problem. And so you decide to go to another gastroenterologist. How do you navigate whom to listen to, who's right, if they're giving you some different explanations? One might want to do endoscopy, colonoscopy, a bunch of tests. The other one might say, from what you've told me, we really don't need all those extra tests because of these reasons. How do you, as a parent, feel like you've done the best for your child?
That is a beautiful question because we really want to be able to pull apart is we have a natural desire to want to have answers, and typically an answer in our general life is we need more data and only in order to have those answers. And yes, but so when I in my days when I was running the pain rehab program at Stanford and we were dealing like with kids with CRPS. And so we can do, of course, like nerve conduction studies, EMGs. And parents would come in and say, hey, can we do an EMG? Now, doing that type of test on a kid with CRPS, exquisitely painful, I would vote often traumatic. And the question I would ask the parent, I said, look, technically speaking, yes. But what I want us to do is pull apart What's our ROI? What's our return on investment for any of this? And what's our potential danger? And what's our potential benefit? So, like in that case, I'm like, look, that's going to be terrible. It's going to be a real bad experience for everyone involved. And truth be told, nothing we find out in that is going to change our course of treatment. We could find huge data and we could find no data confirming what we already think. But either way, our course of treatment is the same. And I don't want to have your child do a traumatic test that doesn't actually dramatically change what we're going to do or even change it at all. And so, like with your GI doc example, to really figure out, okay, when I have a kid, someone's suggesting, to my kids, like, we need to do this test. I'm like, okay, why? What's our purpose? What would we like? What information are we getting out of this that would help us determine a course of action? Because diagnosis is even a different question to me than a course of action. Because the process of all of those things is going to have its own costs. And we're talking doing endoscopy, all of those things. Those are not minor things to undertake. And particularly when we're talking about pain, and you taught me back in the ancient days of the dinosaurs, right? That activation of the very system that's causing us the problem to begin with. There's those chances that the testing itself can create some more issues. And so it's really taking the time to ask yourself and to ask that provider, hey, what is this going to get us? What does this do? Now, if we're talking about doing a scope that's going to tell us whether or not there's a massive ulcer in there, then yeah, that might be a solid thing to understand. But if it's not, if it is really, we're not sure, but we really actually have other non-invasive ways to answer that question, and it's not going to change a course of treatment, then maybe we do that. But when we're able to really understand what the point is and what's the purpose, because there are ways, particularly things like abdominal pain, that we might be able to get the answers that we seek without invasive testing. And the testing itself can sometimes exacerbate. So being able to really look at the ROI and get those answers becomes a really good way for us as parents to feel more confident about whether or not that testing is going to be useful and helpful at that moment. It is very there's a lot of occasions when grief is associated with chronic pain, and I think it's a really powerful example of this biopsychosocial model that has been really established in the research for decades and decades, and certainly within the pain world is the standard, because that is truly us playing out that pain in our body. And that's not weird. It really isn't. I think we have this concept of that is within sort of common culture, that is somehow odd or bizarre. But that's always struck me as weird, that because there's no one who hasn't been incredibly nervous or even, I don't know, seen the, cop lights pop up behind them in the car where there's that immediate physical reaction and pain in our gut. And certainly anyone who's ever been through a broken heart knows the physical pain of that, and that that's not crazy either, and that that pain is very real. And so with grief and loss, it is incredibly common to have chronic pain associated with that, much like chronic pain is very much associated with depression. And I think one of the biggest favors we can do sort of our communities and our world is to normalize that as not a sign of being something crazy, but simply how bodies and people work. Yes, and Samantha Levy, Dr. Levy, Dr. Zeltzer, symbolic pain from grief, such as chest pain after the death. Exactly, precisely. Samantha would certainly have, Dr. Levy would certainly have, she and I go way back too, sorry, Dr. Levy. Um, a million examples of that, as could I. And anyone who's been involved in pain psychology to know that we truly see that pain show up in this physical manifestation that is very, very real. Okay, let's pretend. How do we address that bias that doctors have once they hear that our child has mental health issues such as anxiety, depression, etc., that they attribute? Yes. Uh, That is an excellent question. And first of all, I just want to say, I wish you didn't. I wish I could say that I have no idea what you're talking about. Why would anyone have that bias? But you and I know differently, and that bias is alive and well, and that when kids carry a mental health diagnosis, that very much can lead a certain subset of providers to dismiss the pain of that. And that is where I think being able to ask, how would you know? That's where those how questions is, being like, okay, so knowing that all of this is going to be seen through a biopsychosocial lens, how would you see that? Yes, my child has anxiety. And as you know, it's a great time to throw out some fun stats, which I can't even do off the top of my head right now, but we could. X percentage of kids with anxiety also have pain. So, how does that inform your recommendation for treatment, knowing that both of these factors exist? That yes, we're having depression, but we're not necessarily having pain because of depression or vice versa, but that's going to be a symbiotic relationship. So, how do we want to deal with this given all of these different aspects? But honestly, truth be told, I think you're going to come across some providers, if they are truly steeped within that bias and not willing to shift on their thinking. And that's where I think those how questions allow you to assess someone's ability to shift on their thinking or explain their thought process to you, is to be able to ask those hows. And sometimes you're going to see this kind of shift in growth, and sometimes you're going to see people dig in. Um, and a lot of times the people who are really digging in aren't really going to be your path forward. And I wish that were different. I truly do. But being able to say, okay, so yes, we're dealing with depression. How do we deal with that leg pain? Or how are we dealing with that headache? Or how does that impact the stomach ache? Because that pain is still there. How do we incorporate that into the whole picture? But being able to push back that it's not simply enough to dismiss and say, hey, well, they have anxiety. So yeah, this makes sense. Even if it does make sense, what are we planning on do about that? To be able to tie that to a course of action and their thought process to the choice of the course of action.
I'm thinking, parents have gone to a lot of doctors, and if their child is still not going to school, complaining about a lot of pain, maybe not able to function, and parents become desperate. And so they start looking on the internet for, um, for magic cures. And so that's where they become vulnerable to what they read on the internet, especially testimonials. My child went to, I don't know, Texas or somewhere to Dr. So and so and his magic program or his magic medicine or, whatever it is. And my child is cured now. So then the idea of these untested but treatments around the country that have a lot of testimonials about how great they are, usually at enormous cost because they're not tested, so there's no insurance coverage. But parents are desperate. Can you kind of address that, please?
Sure. Kind of two main things there, I would say. So the first would be, we science and research are good and powerful tools. So we really want to see a research base and a theoretical orientation for anything that we're doing. So I think finding reputable sources of information becomes really, really important. It's actually one of the reasons why I created the Meg Foundation, is to be able to lead people to places with really good sources of reputation in science that we're aligning with the experts. That said, We also know that, particularly for kids and young people, those things might not have a huge research base quite yet. And I think being able to extrapolate, look at that work in the adults, all that. The more, when it comes to pain, the more things that are promised as a magic pill, the less we should have a reason to trust them. Um, I think anyone who works in pain wishes that there was a magic pill. When I was running the pain program, and kids would sometimes in their frustration say things like, that they believe that there was some medication that we could give them that would cure them, but we're not, because we have all these people. And I was like, oh, kiddo, you would never meet a group of people who wish that there was a magic pill that would take care of this. That this group of people that understand the incredible complexity of the pain experience, and unfortunately, then the complexity of the solution to that pain experience. So I think number one red flag is for anyone is if we're advertising anything as a simple end all be all, everyone's red flags should be up for the snake oil salesman situation. Same with incredible cost over time. And this sort of belief that then someone's advertising this is they're the only people who can do this. And this is the only thing that would work. That if a solution doesn't really make sense within sort of this biopsychosocial complicated model, chances are good we're not going to be in a good thing. To remember that anyone can write a testimonial, that the people themselves can write those testimonials. But being able to do your research, to really look at what the research is, even doing things as simple as like looking things like the Better Business Bureau and reviews online, where you can see the people who have gotten less than stellar results from whatever that magical solution is. So you have this balance of these perspectives and a little bit more of our radar up about whether or not these things even make sense. This is also, I think, ideally the role of a good psychologist or a good sort of quarterback for this experience to help you think through where the solutions are, and whether or not this makes sense, how this goes with your conceptualization of your child's experience, how this would fit in, to really break down again that same ROI, that what's our benefit and what's our potential downside, including that downside of I'm out thousands and thousands of dollars, or dragging my child across the country for what could be a completely made up or at least completely ineffective solution. But totally understanding, and I think as providers, being able to understand and recognize that desperation, because of course there's nothing more disturbing than having to watch our child being in pain and feeling very helpless around finding that relief and comfort for them.
Good. Thank you. So your doctor at the end of the visit is explaining what he or she thinks is wrong and what the plan is, and he's going on and on. And it's clear that your son or daughter is tuned out. What do you do?
I think this is a little bit of one is knowing your child, right? For some kids, we are tuned out because we're overwhelmed and we're done, right? Somewhere along the way, this has become an overwhelming experience. And emotionally, we're just checked, because we know the difference, I think, as parents between we're bored or we're annoyed versus we're overwhelmed by the amount of information. And so being able to know when it's going to be back, and part of it's going to be like, hey, I'm sorry, doctor, I want to pause for a second. I just want to make sure that my child is getting this and understanding. Does that make sense to you? Does it make sense why the doctor is recommending psychotherapy? Does it make sense why we need to go and get a PT eval and look at your hypermobility, whatever that is, to be able to check in? And you're going to be able to read I always tell parents, you're the expert in your kiddo, right? And to be sure that you have a good understanding, knowing that you're going to likely be repeating this later to your kid, but being able to also look and being like, hey, I just want to make sure you understand what's going on, or want to make sure that you have any questions. So especially if we're going on and on, that we're kind of chunking that into, okay, here's we want you to do PT. Let's break that down. We want you to do psychotherapy. We want to check this down. We want to do a medication. Check this out. I want you to see a specialist in blah, blah, blah. That we're chunking that information in ways that they can potentially understand. But being able to do that and then check in and be like, okay, buddy, you have any questions about that? Anything else we need to know? And then you'll know from their response if it's like, I'm toasted and I'm done and I'm out and you're going to have to do this later, or I can be drawn back into the situation.
So sometimes I'll see a parent and a teen, and the doctor is asking questions of the teen, and the teen is answering, but then the parent may say, well, don't you remember what about this symptom? Don't you remember when you had the headache? Don't you remember when you, can you comment on sort of the parents' role in providing history in this process when the teen is being interviewed?
So this is why I think, again, that power of making that timeline and that list before is going to be helpful and useful, because it acts as a cue for both of them. Because we don't want to set up the dynamic in there of we're going back and forth, or I'm interrupting my kiddo and they're feeling shut down and all of that. Yet, I think it's very safe to say that a lot of kids and teenagers are going to have a hard time remembering all those things, and not because anything's wrong, because that's completely normal developmentally. And as a patient inside themselves, they're going to have a different perspective than your outside perspective as a parent. And so I think going in, being able to, or even letting them finish their story, and even saying, okay, I'm going to let, yeah, I think that'd be great. Is it okay is when you're done that I fill in any blanks that I think might be relevant that you may have forgotten? That we're not interrupting, but we are definitely sharing information that we think would be relevant. But I think we avoid a lot of that dynamic. And then again, we're like, oh, here's the list that we went over last night that you thought was important. Why don't you share this with the physician? And then we've kind of cut that off at the pass. And not that anxiety that we're sitting there in our brains as parents listening, going, okay, I don't want to interrupt, but there's that thing, and that was the thing, and then we saw that guy, and then we haven't done that. And then we're so busy trying to make that checklist in our head of the things we think they forgot that we're checking out of the story. But I think being able to let them, and then at the end being like, hey, if it's okay, I'd love to fill in a little few of those blanks. But I would really avoid kind of cutting everyone off. At the same time, we're like, we want you to talk to the doctor, but I'm going to accidentally interrupt you every 10 seconds to fill in details isn't probably going to create the flow that we want to create.
What do you do if the child has had lots of unhelpful to him experiences at doctor's appointments? Either they've undergone a lot of tests, blood tests, and they're still in pain, whatever the outcome. And the parent finds out about this great doctor, and they want the child to, they made an appointment. And of course, it takes months to get in. And they finally have the appointment, and their kid refuses to go, or will come in the car and refuses to get out of the car. So you have this dynamic of the mom or dad trying to do the best and is excited, and finally the appointment is there.
Finally, it's our moment. Yes. Well, there's a lot in that. But I think part of that again is what's happening in the build up. Frankly, I think the child's probably reacting to a question that we should all have, which is, why should I go? Right? What is the point? So I think a couple things in there. One is the importance of acknowledging and validating their feelings of like, hey, this has not gone well at different points in time. And I think not helpful is probably going to be our most diplomatic way of saying that probably somewhere there along the way, and not only was it not helpful, but even potentially damaging or really painful psychologically or physically, and that those things that did happen, right? To not pretend that every healthcare experience on the planet has been pleasant and delightful and gotten us further down the path, that a lot of this has been frustrating. So I think the validation of that experience, but also recognizing that, hey, we're not where we want to be and we need a path forward. And then being able to answer both for yourself and your child. So, why this appointment and why this doctor? How would this be different? And I think that's an important question for a parent to have an answer to going in, and for the child to be given, being like, hey, you're right, bud. But I think what we've discovered in all of these previous appointments is that whatever's going on is not a simple A plus B equals C. It's not, I have a tummy ache, I'm going to get a pill and I'm going to get better. That's not what's going on. It's more complicated.
Right.
And complicated problems need complicated answers. And that, Dr. Zeltzer is this amazing person who her whole thing is dealing with kids with complicated pain issues. That we need her brain helping us figure out what's going on. And this is how, or this is what's going, this is the process that we think would be helpful or useful, or potentially helpful or useful.
The recommendation from the doctor is go to physical, have your son or daughter go to physical therapy. Okay, that makes sense. And also engage in psychotherapy, which may not make sense. And for the kid who has stomach aches or leg pain or CRPS, pain in the foot, that, he can't walk because it's too painful. So physical therapy makes sense, although we might say, even with that, I've been to physical therapy before, it's too painful, I can't do it. But for the psych part, I think that's often very hard to understand. How is talking to somebody going to help my knee pain?
And I think as providers, we want a real good answer to that question kind of at hand. And as parents, I think that becomes a goal of how do I explain this to myself and acknowledge our own biases that we bring in, that if we are talking about engaging, how do I think that I don't think my doctor thinks I'm crazy or thinks I'm a bad parent because now I have a kid who's crazy, or this is somehow my fault as a parent. They get that same response when we talk about psychotherapy involving parents, and frankly, in my mind, always should when we're talking about dealing with chronic pain, because this is not our fault as parents, but it certainly changes the way we have to parent. And this is a unique situation, right? And it was always striking to me on that point when I first started doing diagnosis counseling, and whether that was cancer or whatnot, and a parent would turn around often and say to me and say, I know I should know how to handle this. And I'd always look at them and be like, why on earth should you know how to handle this? When you had a kid, were you like, maybe when they're 8 they're going to get cancer, I should brush up on my cancer parent parenting? How bizarre. No, I hope you don't know how to handle this. But now we're in this situation, and now we need to develop a set of skills of how to manage this. And I said same thing with pain, of like, look, this was not in the manual, the non-manual that you got handed when this child came into the world. But the uniqueness of this situation, we got to learn some different strategies. And so I think part of that for both parent and provider is always calling out the elephant in the room, being like, I want to be super clear that I'm not telling you about a psychologist or therapist because I think you're nuts. I don't think you're nuts.
Mm-hmm.
And this is our opportunity to explain that biopsychosocial, in every single aspect of pain we ever have, is going to be a biological, psychological, and social experience. And one of my favorite examples, just because everyone on the planet can relate to it instantaneously, is I will say, look, have you ever noticed that when you stub your toe, it hurts worse if you're in a bad mood than if you're in a good mood? And everyone's like, oh, yeah, totally. I'm like, great. So that momentary fleeting experience of pain is completely influenced by how you're feeling. So after months of experiencing this pain, I guarantee you it's influencing how you're feeling. And P.S., it's depressing to be in pain all the time. It creates anxiety to do that. That is not weird. That is not bizarre. It means you're paying attention. And so we have to be able to help support you to figure out how you want to manage and handle this and to develop really amazing self-regulation and coping skills. And when kids come back and they're like, I have good coping skills, I'm saying, you know what? I would even agree with you. But for this, for what you're going through, we need Olympic level on the podium coping skills. That the normal, if everything were all the same, that yes, you'd be great. If everything was going well, your body was acting the way we wanted it to, you'd be good to go. But it's not. And so we got to go bigger, stronger, faster in order for you to be able to live the life that you want to live. And that's not because you're crazy. It's because you are in a unique situation that we got to respond to and we got to help you figure out.
Now,
But we know that we're always going to have to repeat that we don't think they're crazy.
now, those are key points, and I just want to point out on as part of the CHYP team, Dr. Samantha Levy does an 8-week program with a limited number of parents so they get to know each other. It's on Zoom on parenting the teen who has chronic pain, because as parents, we're not instantly born with that knowledge. And your kid doesn't want to school, he doesn't want to go to get out of bed, and he's sleeping all day and up all night, and he's on iPhone at night. He's playing video games all day because he said that helps distract him, but he can't do any schoolwork or go to school. As a parent, how do you handle this and know what the right thing to do? Again, we're not instantly taught how to parent a kid.
Well, and it's a moving target. And I think it's brilliant to have the resources of like the course with Dr. Levy, because it's so important to have that support. Because we're talking about within parenting a kid with chronic pain, there's that push and pull of we need to push out of that comfort zone, but we need to not push too hard. And it's a total skill set to figure out how to balance that. When do we do, when do we not? How do we think of pain? How are we changing the way that pain feel, that what the meaning of that pain? And so I absolutely think it's so important. It was why we required, when we came in, the number one thing that we got pushed back on when we were running the chronic pain program, that we required family therapy, parenting coaching, and individual psychotherapy. And the number one thing we got pushed back on was family therapy and parent coaching. They're like, well, we're not crazy. This isn't our fault. I'm like, no, I don't think it is. But I think to get you out of where you've been, this requires a set of skills. And I want you to have all the support that we can provide you, because it is going to be essential to have that. So I think having that support from someone like Dr. Levy is game changing and completely essential. And just support and the what we can and getting from each other and having other parents who understand what you're going through and who can see you, right? That your experience is a lot different than, oh my gosh, my kid plays Fortnite too much and didn't finish their math homework, is completely different than the dynamic that you're talking about going through.
Right. No, it's like being on a old-fashioned seesaw, and you're in the middle where it's balanced. If you move a little bit this way, it goes down.
Going here and we're going here. And even normalizing that. I also want to let people know that the amazing I know Rachel Coakley, Dr. Rachel Coakley is on your board, and her their their advisory board of young people with chronic pain did an amazing podcast. Which I think is such beautiful validation of the experience of someone going through pain treatment and normalizing all of the different things that are involved, but also normalizing those feelings of I don't want to, or this sounds crazy, or they're trying to dismiss me. And it's just beautiful validation from the horse's mouth, as they say, from these incredibly wise and articulate young, this happens to be a bunch of young women with chronic pain. But I think it's a great thing to have kids listen to be like, all right, you don't believe me. What would I possibly know as your parent? But let's listen. Let's listen to this.
Yeah.
But also, so we have a question here, Lonnie, about any thoughts on looking for a pain psychologist versus everyday psychologist?
Ah, good question.
Yes, that is a phenomenal question. So I think so. Unfortunately, the pain psychologist is hard to come by. Frankly, at this day and age, any psychologist or mental health professional is hard to come by. Um, so this is a really, really great question. So part of it is going to be the goal. We want to think about that again in that conceptualization of picture that we want coming out of some of these appointments. We're thinking about depression and anxiety, that if we're treating that and we have a psychologist who's designed to treat anxiety and depression, and that's we can't find the pain psychologist, but we have the psychologist who treats anxiety and depression. Good. Okay, we do need to treat that. I think it is going to be really helpful, important for that person to at least be able to put that within the relationship of chronic pain, right? And that what I think that gets dangerous only when there is a sort of a belief in that biomedical model and a separation of that. That's always going to be the doubt in our minds. We don't need to be dealing with a professional who's going to inadvertently reinforce that dichotomy of brain and body. That said, that doesn't mean someone who's not a complete expert in chronic pain couldn't be helpful and useful to you. That when we are specific on that goals being self-regulation skills, correcting some of the behaviors that are becoming problematic, that are driven, at least in part by the anxiety, depression, that's going to be helpful and useful. So I think being able to have a really frank discussion with that provider and saying, hey, this is where we are, this is what we need. What's your comfort level with this? I don't need you to be a complete pain expert if that's not your thing, but I do need you to understand how these things play out and how we want to think about that in terms of treatment goals for that provider.
I do want to mention that we've had a Creating Bonds teen self-help tools program, and we're filming that, but with opportunity for discussion. And so we have 3 of the 6 filmed, but it's guidance for the teens on how to navigate this system. I recommend that everybody go to our website, and obviously donations are welcome, and everything we do is for free. We want to really help as many kids and parents as we can. I want to thank you, Jody. Fabulous, very important webinar, and thank everybody for coming.
And if it's okay, Ashley, I just want to mention too that we love partnering with CHYP at the Meg Foundation and are so grateful for this collaboration and partnership. And that we also have other free resources that we have on the Meg Foundation website that are also free and available to everyone, and great resources also to be handing providers who you don't think are quite getting it quite yet. To help them out. And thank you so much for having me. And thank you so much for doing this. It's been a total pleasure.
I want to add one quick thing. One of the things that Jody has on the Meg Foundation website that we're not addressing, that a lot of kids have needle phobia. And there's a lot of information on helping your kid get blood tests, get vaccinations, etc., where your kid has a needle phobia. So just want to throw that in. Thank you so much. Thank everybody for coming, and we'll sign off.